Okay, so how can I help you today? So what is bothering you? Do you have any concerns that I can help you with?
To see you because lately I've been looking very tired. My mid-face looks very kind of drooping. So I was wondering, is it possible to help with that, just to have some kind of lifting?
But that we had an issue with the under eye swelling just because you had filler done elsewhere before, which we corrected. So sometimes after correcting such issue, people develop or feel and look a little bit more hollow. So we can actually implement a procedure called dermal filler to restore lost volume in the mid-face, because that sometimes happens once we remove the pre-existing filler, and it can affect the other areas that you had fillers placed before. So having filler in the mid-face helps to restore that lost volume and creates more of a lifted appearance, especially here. So it also improves the appearance of the jowls, the sad smile. So it generally, we can't say that fillers lift, but by restoring lost volume in the mid-face, we kind of create an illusion of that.
Explain more about the procedure, please.
So the procedure is done with an anesthetic, which is called lidocaine. So the product contains some lidocaine, so it makes the procedure very well tolerable. People do not really feel much pain. They do feel quite comfortable during the procedure. However, it can sometimes feel a little bit weird, but nothing too scary. If by any chance you feel any discomfort, just let me know and we will stop and we will have a chat what would make you feel better. So what would be the aftercare? Generally we do recommend to avoid any alcohol intake 24 hours after the procedure, as well as no painkillers such as aspirin or ibuprofen. It's best to take paracetamol. It doesn't make you bleed as much. It doesn't really thin your blood. Another thing I would recommend would be no makeup, no skincare products for the next 24 hours, especially after fillers, because fillers we consider as temporary implant under the skin or tissue, so we have to be extra careful when we after we perform the procedure. Now, another thing I do recommend for 4 weeks after: no massages, facials, no other skincare procedures or cosmetic procedures, just to make sure that everything stays in place.